You can read it. Doesn't look at me. Provide a patent airway. Wait a minute. So you would put an ET tube in somebody to keep the airway open? So you don't need to put them on a ventilator?
No, you have to.
What kind of patient is it? They don't need a ventilation, but they just need an ET tube. Okay.
Does every intubated patient with an ET tube have to be on a ventilator?
No.
Only when indicated.
When would they not be on a ventilator but intubated?
Surgery?
They're breathing on their own.
That's one good
I would think
reason.
surgery is
Trauma?
one.
To the
Trauma.
upper airway?
Mhm.
How about patients with stridor? Upper airway swelling? They can't breathe. You put a tube down there and now they can breathe.
The bee stings, the
Alright.
anaphylactic shocks.
Yeah, nasal or oral, yeah. And if you want to suction someone frequently, it's probably better to have an ET tube in place. And if you want to put somebody on a ventilator, certainly you have to have an ET tube. And to protect the airway, and before you intubate anybody, you can give some medications. One of them is Narcan. Have you ever heard of that?
I've heard of that.
What's that for? Yeah, Narcan. Narcan, you can actually install the medicine in the ET tube.
Yeah, all those meds
Go in the
can go straight down the ET tube for faster absorption into the body.
Narcan.
You don't give those to intubate. That's
Right, right.
yeah.
You don't give them to,
They're just examples of what.
like doing a code or something. If they cannot establish a line and they want to give the medicine really fast, and we give all those medicines. Just read through that. That's Kathy's job to teach you all that stuff. Complications. Complications, infection.
But you might use wouldn't you use Versed? Wouldn't you use that maybe for,
I really
to
thought
put the
like that.
tube down? Did you ever give them Versed?
Yeah, we're set. Yeah.
All right, go ahead, sorry.
You'll
Now-
learn all those meds later.
Yeah.
What
Well,
meds?
isn't Versed one of them?
Yeah, no.
Down, it says Diamond Versed.
I'm going to skip all these things and move on over to the questions. Phase 3. ET tube sizes. So obviously they have different sizes of ET tube. Adult male usually have 8 to 9. We use 7 to 9. Adult females 7 to 8. And ET tube markings. Just read through that.
Let me pass these around so y'all can see the markings that we're talking about.
Okay. Kathy, what's the size of the tube you have in your hand?
6.
Whoop! Sorry.
It's a 6.
I'm not.
And what's the length? The maximum length?
26.
26 what?
Centimeters.
Looking at
So 6.5 is the size.
and then
It's a
And then
6
26,
French, right?
24,
Yeah, right.
wherever it lands at
6
the
French?
corner of the
Is it
mouth.
French for that?
Or not?
That's how you know where it's, so if this is at
Yeah,
your
but it's
mouth, the
26
corner, you say, okay, it's 18 at the lip, size 6.5.
You guys measure it to 11?
What?
Hey, tell me something. When it says 15
We usually do,
millimeter,
or the
is
teeth,
that this way
whatever
or
is your
that
preference.
inside?
But I mean, if you're
Outside.
writing it down
Outside,
on a
okay.
sheet, do you
This,
write
yeah,
on it?
Either one. Lip is more common,
Just so
So
you know.
everybody know how
the
to
corner of the lip.
look at the size of the tube. Because I've been taking students around, I usually ask them what size the tube it is. And they all kind of looking at different areas. I don't know if they're looking at the right place.
Well, this 6 is on there twice. It's at the top of the tube near the mouth.
there's at the
And it's
bottom
also
too.
down further, I guess, when you're putting it in. So it's actually on the slide.
Did everybody see the number of
It's
ET
down
tube on it?
here,
Yeah.
we're not gonna see
You
that.
see the
It's gonna be
size.
in the
Size.
And the length.
always on
And
the
the size is here also, and then the length, how far it goes up to.
Yeah.
And the one ET tube in Helena's hand, look at that, that's a little different than the one that you all
Got
have.
It has
this
the-
extra port.
It has the
hanging.
suction thing, and then it has the balloon for the cup.
That's for the inflation.
This piece is the inflate the balloon that will block off the trachea. This piece, and I'll pass this around, if you look at this, right up at the bottom, there's a hole here.
That's the,
No.
that's the suction.
So this will actually go, this little port will hang out of the mouth as well. And you hook a separate suction up to this one, and it slowly suctions out the saliva that falls behind your tongue. Now, when you set this, it's only set at 20. So it's hardly anything, because what if this is stuck up against your trachea? They don't want it suctioning the tissue from your trachea, so they keep it really low. But let me pass this around. The hole, you can barely see the hole. Not big. I don't think they do a lot of help.
That hole is right on top of the,
Oh.
The literature says that they do when they're used properly.
Talking about
Oh,
this hole.
sure.
that hole they're looking at.
The literature
I mean, that
says
hole
that
you're
what?
Well,
looking at is
it's
over here.
so-called research.
Right there.
Or is that the eye?
Yeah,
All right, right above the cuff.
yeah, right about the cup.
Where everything, yes, thank you.
It suctions around the.
I'm telling you, John, when we start looking at
Because
them,
that
you
cup
will
is
see.
inflated, and then you got
Have
that
to
hole
put a
there.
yanker down
Suction
somebody
in.
and sit with that yanker for days and pull junk out. But that 20 is not getting.
That can cause pneumonia. Think about it. Every time.
And what
you
we
eat
always
place,
have to do is sit
Yeah,
there
then all
and
that
take
everything
10
will
will
pieces
drop
of
back
syringe
into
Right.
the lung.
and aspirate that stuff out. Because
So this
20
one you
of
can
suction is just.
So you should always,
keep
I
that
would
thing
think,
up for
suction
100 all
that before
day.
you exit.
It worked.
Or if it has a series of
Correct.
holes all the way around it.
It might work better, but yeah. We'll start showing all those.
Yeah.
It's a great idea.
I know, I don't know why it
That
wouldn't be
was-
the standard for all these YouTubers, but if
Yeah.
They try it, the squads don't have them, so if somebody comes in with a squad
Yeah,
intubated, we're not gonna
Ventilator
re-intubate them just
associated
for one of
pneumonia.
those.
To prevent
Sometimes the
VFP,
surgeon, they
they
think they're gonna be
invented this
extubated within
ET
24
tube,
hours,
so
they
they
won't
can
use
suction out
those.
all that mucus
are they
It's
more
like, why
expensive?
not?
right
Guess
above
they're
the
more
cup.
expensive.
If it
Slightly.
falls back into your lungs, that
But-
causes
That hole
pneumonia.
Suction hole.
Everything
So-
else has a fancy name.
All right, guys.
Yeah, what's the name of the
what's
hole,
the name?
Benny?
Yeah, they're high-low ET2, okay?
I will.
High-low.
And I still don't even get that either.
High,
Suction high, suction low.
yeah.
Really? What's the name of the hole on the, at the top of the cuff?
Murphy's.
No,
No,
that's a completely different hole.
penny stump.
It's called the suction
hole.
hole.
The suction hole. Are you serious? There's no name for that, it's just really called a suction hole.
Yeah,
She just,
suction hole.
Just call it the Benny hole.
The hole that's connected
So,
to.
everybody is familiar with the ET tube now, with the size and the length.
right.
Yes.
Now we can move on to the next. The next one is, we talked about the cuff, right? Wait a minute, now, the cuff. Did Kathy talk about the cuff on the ET tube?
Yeah.
The
Yeah.
pressure and
You
stuff?
showed us, yeah.
Yeah.
The different pressure?
No, she didn't talk about
Yeah,
the
she
pressure.
showed us the, well, she
She didn't
talked
talk about the pressure.